Hi, I'm Melissa Hood from the Parent Practice, and at the time of recording, we're in the midst of the coronavirus emergency. So I'm making this video to help you deal with your children's feelings about it all. As the COVID-19 virus has spread around the world, and in different countries, governments have put in place many restrictions on our movements, we have had to adjust to new normalities at a very fast rate. As panic stockpiling of toilet paper and other basics indicates, some adults are becoming very anxious, so it's no wonder if our children are worried about what they're hearing. The first thing we can do to help is to be aware of what they are hearing. Never assume that your children aren't listening to your adult conversations, even if they seem to be preoccupied and not bothered. If you've been talking about it within earshot of your children, or they have been hearing about it on radio or TV reports, then you need to address it with them in a way that they can process at their age. The spread of this virus is something that is still unfolding, and we don't know what the scale of it will be. It is certainly already having a big effect on the lives of ordinary families, even if they have not contracted the disease themselves. So the first thing that we can do is to be informed, but not too much. This is an unprecedented public health emergency. As usual in the internet era, there is misinformation swirling about, so do make sure you get your facts from a trusted source, such as government websites. Obviously give information to the children according to their age. The questions they ask will help you to make what you say relevant for them. You'll need to manage your own anxiety by not scrolling through endless sites in search of information. We recommend you limit yourself to once a day. Now, the second thing to do is to listen to your children's concerns. Obviously, one of our main ideas is not to make our children needlessly worried. They need to know that the adults can and will keep them safe, but it won't help any anxiety they're experiencing to dismiss their concerns. So don't tell them not to worry, and don't tell them not to moan because everyone else is in the same boat as well. Let them have their feelings. It's much better if they express them than keep them in. I would descriptively praise them for telling you how they're feeling. Let them know that this is a mature and healthy way to deal with feelings. So, when should you talk about it? Well, if your child brings it up, do respond to them there and then if you can. If it's at an inconvenient moment, such as bedtime, which is very common in my experience, then bear in mind that if you put off the discussion, they may be dwelling on their worries, and so they won't be able to get to sleep anyway. If it's not possible to talk there and then assure them that you will talk about it as soon as you can. If they don't raise the subject, it might still be a good idea for you to introduce it calmly, maybe away from bedtime, so that you can set the tone and give them the information that you think is right for them to hear. Choose a time when things are calm and hopefully you won't be interrupted. So, how to talk to them? Obviously, as we've said, stay calm. We know that anxiety is very contagious, so it's important that you get your own feelings in check before having a conversation with the children. Now, that's particularly important if you know that your child is prone to anxiety. If you're aware that you seem stressed, acknowledge it and let them know that you are handling your feelings by getting proper information and by using your usual stress busters, such as going for a walk, listening to music, taking a bath, or meditating. Give the kids lots of hugs. So, what to say? Well, we need to acknowledge their fears and don't make false promises. So if your child is worried that the people they care about might die, acknowledge that some people might die of the virus, but that's rare and less likely when people are healthy, and also that there are things people can do to protect themselves. You might want to explain that most people who experience symptoms will get better on their own. Maybe say, "I can see this is really bothering you. Of course you don't want anyone to get sick. I'm glad you care. You and Mummy and Daddy are young and are all fit and healthy, so we should be okay. Papa and Nana are older, but they're generally well, and they're keeping themselves at home mainly, so there's less chance of picking up the virus. If any of us do get sick, the doctors and nurses will take good care of us. Tell them that doctors and scientists are also working on developing medicines to help prevent people from getting the illness and to treat them if they do. The kind of listening we're talking about is an example of one of the essential skills in our positive parenting courses, emotion coaching. It involves acknowledging and validating children's feelings so that they can learn how to tolerate and move through uncomfortable feelings. As well as anxiety, we also know that children will experience other emotions related to the coronavirus experience. Many adults will share their feelings of disappointment. As birthdays and weddings and holidays have been cancelled, we all wish this virus thing wasn't happening. Every single one of us is dealing with a really challenging situation. Some may be worried about their jobs. Some may have to close a business and lay off staff. We may have to work from home and look after children at the same time. We might also have to juggle care of elderly relatives. We might be health workers who are exposed to a much greater degree. All of that will bring with it anxieties, as well as disappointments and frustrations, and perhaps feeling like we're not up to the task. If we're going to find creative solutions to our problems, we need to first address the feelings. This is what we need to teach our children to do, and we have to model it ourselves. We know from research using fMRI scans that when people try to suppress their feelings, the emotions are still occupying their brains. That research showed that naming the feeling is what helps it to dissipate. So what have you or your children been disappointed about in the last few weeks? What have you had to miss out on? Maybe seeing friends at school or your usual yoga class? What has frustrated you or them? Not being able to get their usual cereal or disinfectant or toilet paper? Your neighbours being even noisier now they're all at home? What's making you anxious? It might be worries about your finances or whether your child will fall behind in school. Sit down and talk to your children about some of these feelings, not the more adult ones, but some of them. And this is not a negative moan fest, but it is a necessary airing of emotions to allow you to move through them. And it gives your children permission to express how they're feeling, which will help the feelings to dissipate. One way to keep anxiety in check is to mention the good things that are going on too. One mum undertook to report one item of good news every day for her son, so she mentioned the fact that the canals in Venice are much cleaner, and the special hospitals that were set up in China are closing because life is beginning to return to normal there. Then discuss how you're all going to deal with your feelings. Are you going to talk about them, journal them, draw them, take exercise, run, dance, jump on a trampoline, listen to calming music, get out in nature if you can, do some sorting out or some cleaning, or maybe build Lego, meditate, listen to mindfulness apps, play with or care for an animal? Let each person choose their own favourite stress-busting strategy. It will also help if you can give the kids some control, because a lot of anxiety comes from feeling that we can't influence events. So empower them as much as possible and let them know how you as a family plan to deal with things in the event that someone gets sick or if you need to be quarantined. Let them know that the government has put in place plans for dealing with the situation. And what they can do themselves, of course, is to follow basic hygiene procedures and maintain physical distancing. Rather than nagging them, descriptively praise them for doing thorough hand washing and catching a sneeze or wiping a runny nose properly with a tissue and then throwing it away, or coughing into their elbow rather than their hands. Let them stay in touch remotely with friends and family, especially grandparents who they might be worried about. Video-based technologies allow us all to stay connected, and that's really important in times of stress. Grandparents can even help by talking calmly to children when parents might be stressed, and they might be able to help out with schoolwork or reading stories. They can also play games like Scrabble or Tic-Tac-Toe or Hangman or any kind of word game You remember the kind we used to play on long car journeys before videos came along. Stay well and use this opportunity of being at home to build family togetherness. Take care.